Did you know that this is American Heart Month and cardiovascular disease kills 1 American woman every minute? That's why the National Heart, Lung, and Blood Institute began the Heart Truth, a call to action for women to protect their heart health. But sometimes doing everything right is not enough. Dr. Richard Besser has one woman's story.
My name is Chris Steiger. I'm married to a wonderful man named Jim, and I have 2 kids. My son is Noah, and he's 12, and a daughter, Lily, who's 9.
Christine had always been the picture of health, or so she thought.
4 days after my 39th birthday, I had a heart attack, which was quite surprising to me because prior to that, I was in the best shape of my life. I was exercising every day, running 5 miles a day, and eating healthy.
Christine was on her way to dinner with her family when something strange occurred.
I was taking my daughter from the car and setting her down and felt a sharp pain in my left arm, right above my elbow, and just honestly thought I had pulled a muscle when I set her down.
But the symptoms didn't subside. In fact, they got worse.
As moments went on, my whole arm felt numb.
When she began to feel lightheaded and experienced pressure in her chest, her husband Jim took her to the emergency room. Doctors soon discovered that Christine had suffered a heart attack.
They put in 2 stents and determined that I had a 90 to 95% blockage.
Christine became even more dedicated to her healthy lifestyle, which was why she was shocked when she ended up in the hospital again.
I had a second heart attack almost exactly 5 years later.
Christine had no family history, so she never expected she was at risk.
This story just illustrates that young women are at risk for heart disease as well as older women, and that all women across all age ranges should be aware of their risk.
Christine takes medication daily, exercises, and continues to watch her diet. But her own experience has taught her the value of being vigilant about her health.
My doctor told me that if I had ignored my symptoms anymore, I would have gone home and probably just never woken up one day. And I have a husband, I have 2 kids, and to lose all that just because I was afraid to go to the doctor and to get checked out is just ridiculous.
Although her healthy lifestyle didn't prevent her from having a heart attack, it's very likely, Robin, that her lifestyle led to her successful recovery.
Yes, it did. So tell us about the risk factors. What should women look out for, Rich?
Well, there are those things that you can't change: your age, your gender, and your family history. It's very important you know your family history because that may change the way a doctor approaches you. Then there are those things that you really can change. Smoking is #1 on the list. You shouldn't smoke, and if you live with a smoker, get them to stop. Your cholesterol. Know what your cholesterol is and take those measures to improve your cholesterol.
Okay.
Your blood pressure, make sure that's under control. That's a big one. Your weight, make sure your weight's under control, and exercise regularly. Those things are modifiable risk factors that can really reduce your risk of heart attack.
We've heard about the classic symptoms, you know, the chest pain and the pain in the arm, as Christine explained, but there are so many more that we should watch out for.
There are, and some doctors really have found that women have some atypical signs. Pain in the jaw, you know, that's something that is rather unusual. Chest pain, that's something that many people will have, but a pain in the jaw or the neck, pain that will radiate down your arm, those are risk factors that are important. Nausea, heartburn, things that some people just associate with an upset stomach. If it's unusual for you, that's something to worry about. Shortness of breath and real fatigue.
Do you know, of course you know why women are more susceptible?
Well, you know, there are a couple things here. It's been shown that women are less likely to get the full treatment for heart disease. They're not treated to guidelines as frequently as men. I think that's because doctors don't appreciate that women can have heart disease and do have heart disease as frequently as men. An exciting thing is that researchers are undertaking a large study of heart attacks in younger women to try and identify what are some of those risk factors and what can you do to prevent those.
I'm glad you said that last part because we've heard from women who said their doctors didn't even diagnose it correctly. They were even saying like, oh, Probably nothing.
You know, I think it would be a mistake for women to come away from this and say that exercising and eating right doesn't help, because clearly those are the most important things you can do for preventing heart disease and so many other things in your life.
I know you're going to talk more about this, Rich, and to learn more about heart health and your risk factors, go to our website at abcnews.com and click on GMA. We even have some heart healthy recipes for you too.